Syed has worked in the NHS for 25 years, and for 20 of those years he has been the Trust's financial accounts manager. Before he left, our previous Director of Finance provided the following testimony. He said the NHS would not run without the goodwill of individuals such as Syed. His quality of work and eye for detail is excellent, his attitude towards his team and others is exemplary, and he goes around his work with a smile and a cheerfulness that supports a great team spirit. Syed is truly one of the unsung heroes in the NHS.
He's an unsung hero because essentially, however chaotic and busy and mad the pharmacy world gets, he never fails to put the patient first. He just always thinks about doing the right thing for the patient and never thinks about himself at all. And he joined us from UHL about 5 years ago, and we took over the service from them. And when we were taking over that service, all the nurses said was, "Please don't let us lose Roman."
She has always worked so outstandingly well, and she's always gone over and above her role as a Band 4 medical secretary to improve the experience of our patients. And she's very, very dedicated to the patient experience, and she takes a lot of pride in the work that she does within the team. The reason I've nominated her for this award is because she has always worked so outstandingly well, and she's always gone over and above her role as a Band 4 medical secretary to improve the experience of our patients. And she's very, very dedicated to the patient experience, and she takes a lot of pride in the work that she does within the team. When we started in the memory service a few years ago, started to develop the memory service, next we took it upon herself to help us with the data cleansing. So she became part of the patient tracking list meetings, and a year later we started with the referral to treatment pathway. This meant that we had to see patients within 18 weeks, and they needed to be treated and seen within 18 weeks of referral. Next, we took it on ourselves to actually learn about the pathway, understand the pathway, and put systems and processes in place to help us to support the pathway. She was given access rights from HIS so that she could undo any mistakes that had been made by clinicians, and she also took it upon herself to train members of staff, whether that be our consultant psychiatrists, our nurses, or our admin colleagues. She was very keen to ensure that the data was cleansed, and she was very dedicated to this work because she knew that it made an ultimate difference to the patient's experience, and that people were seen and treated sooner. She's just an absolute asset to have on any team. She's very passionate about the work that she does. I'm really proud to have her as part of my team, and I know that anybody that works with NextMe would feel the same. The whole team absolutely think that the work that she's been doing is amazing.